Why do you want to get your back better? Most people want to see their pain reduced, but are there other activities you want to get back to? You want to get back to golf, gardening, playing with your grandkids, going back to a sport or activity, back to running, for instance. Hi, my name's Rob Holmes. I'm one of the physiotherapists here at Evidence Sport and Spinal Therapy. Today I wanted to go over a quick preview of what it looks like to come in for an assessment for back pain. So let's look at how we approach back pain here. So low back pain is very common. 80% of us are going to experience at least one episode of back pain in our life, or the leg pain and sciatica that's associated with back injuries. Fortunately, many of those things are going to get better on their own, but sometimes you're going to need more help. The most important thing in helping you manage your back pain is to do a really thorough assessment so we know exactly where your back pain is coming from. That's why we're going to take the time to sit down and chat with you about where your back pain is, and then do a really thorough clinical assessment so we know where it's coming from. It's really important to have a super accurate diagnosis of your back before we get into doing some treatment. So the evidence tells us that while back pain is very complex, sometimes the best way to deal with it is the most simplest approach. Keeping active when you can, doing really decent exercise. And there's lots of good exercise for your back, but when you're sore, it's hard to know exactly what to do on your own. And so that's why we're going to be able to show you the exercises that are best for your back that you can do yourself based on what we find in your assessment. The other things that are helpful, the manual therapy or hands-on treatment, especially for episodes of acute back pain, has been shown to be really, really helpful. And for more chronic back pain, especially chronic back pain, which is muscular, intramuscular stimulation or dry needling can be very helpful. So the challenge is, we know that being as active as we can is the best way to manage back pain, both acute back pain and chronic back pain. 20, 30 years ago, we would have advocated bed rest and other resting your back until it gets better, but we now know that that doesn't work. So we want you to be active. But the problem is that your back hurts. So what can you do to get it better? Well, that's where physiotherapy is going to help you, because we're going to be able to tell you activities that are good, activities that are maybe not so good and you don't want to push it with. But generally speaking, we do want you getting back to your normal activities as soon as possible. Part of that is what we call therapeutic exercise. And this is really interesting because what happens with therapeutic exercise, you have a ton of muscles in your back, just like in the pictures that we saw. And you can use those muscles to help get your own back better. So you're not relying on us to help get you better or other people to fix you. You can use your own back muscles to get the change that you want and the pain relief that you want. In many respects, a physiotherapist will prescribe therapeutic exercise the way a doctor might prescribe a medication. Now, while therapeutic exercise, getting back to your activities is the cornerstone of what we want in physiotherapy to get you better long term, sometimes you can do all the movements we ask you to do and all your normal activities of daily living and be left with some of these tight muscles you can't get rid of on your own. Similarly, when we do the manual therapy, we're going to find that there's certain things that we just can't get. So what we do then is we try and identify those tight muscles in your back that might be causing some of your pain or restricting your mobility, and we take a little acupuncture needle and insert that into that muscle to try and release it a little bit. It's a very, very fine needle. And as such, what happens is that it doesn't feel like a needle at all. So that's the good part. What happens is we take this single-use needle, we insert it into your back, into the tight muscle. Now, sometimes people find that uncomfortable, and sometimes it's not bad because it feels like we're finally getting to the area that's the source of your pain. So the second thing we commonly do in physiotherapy is what we call manual therapy. That's a hands-on technique whereby we're going to help you do some movements for your back. There's going to be some parts of your back that you can't get moving either through exercise or through your activities of daily living because of either pain or some restricted mobility. And we can do some stretching, mobilization, muscle release, and manipulation to help you with that. So if we're not seeing the progress we want after 3 to 4 sessions, we want to know why. At that point in time, we might go back, have a discussion with your doctor about further investigations that might be needed, perhaps a trial of some medication, and if needed, we can even talk about some different interventional procedures, such as a facet joint injection or epidural steroid injection. In certain cases, we're going to need to collaborate with different doctors and different expertise. Fortunately, we work down the hall from a very talented group of physicians that do different types of injection procedures. So if you're experiencing back pain that hasn't gotten better on its own or hasn't gotten better through other treatments, We encourage you to come to Evidence Sport and Spine and seek out a multidisciplinary approach to getting your back pain better. If you have further questions, please comment below or call us 403-210-9969.